Welcome to Chem Help ASAP. In previous videos, we have focused on one way to measure Vd. There is another. The approach we have used to determine Vd requires determination of a molecule's half-life and then clearance. From these two values, we can determine volume of distribution, Vd. This approach uses the linear portion of the natural log CP time curve to calculate minus KEL and then half-life. This method works fine and follows something called the one compartment model. Normally, when you look up Vd values and references, the Vd values have been determined in this manner. This form of Vd is sometimes called terminal volume of distribution because it's based on the terminal elimination phase of the molecule, the portion of the ln-CP time curve that is linear. This method poses a problem. Some molecules require a long time, even days, to achieve full distribution and the terminal elimination phase. Are there other, faster ways to determine Vd? Yes. Let's think about the dynamic nature of distribution for an IV bolus. When the drug is first administered at time 0, and in the case of an IV bolus, concentration in the plasma, the central compartment, is very high, but the concentration in the tissues, the peripheral compartment, is low. The molecule will distribute with a net flow to the peripheral compartment. The concentration in both compartments will soon be the same. At this point, the drug is said to be at steady state, and the net flow between the compartments will be 0. As elimination via hepatic or renal clearance occurs from the central compartment, plasma concentration will drop and the net flow of the molecule will be from the peripheral compartment back to the central compartment. It is possible to measure the level of distribution at the steady state concentration through methods that we have not discussed. This type of Vd is called Vdss or just Vss, volume of distribution at steady state. Steady state and terminal Vd do differ. Vdss tends to be smaller than terminal Vd because at steady state the molecule has not yet fully permeated all tissues. Let's quickly think about the implications of having different Vd values. Remember that half-life is determined by both volume of distribution and clearance. If Vd is not constant, the half-life is not constant. This idea shocked me the first time I learned it. For drugs that are taken for a long period, days, weeks, and even years, the dynamic nature of half-life is not an issue. The drug is continuously, fully distributed and following terminal elimination. For single-dose drugs, especially drugs administered by IV bolus, researchers have found that Vdss is a better parameter for determining a safe and effective dose. I hope you enjoyed this video. Please post any questions you have in the comments section. Take care.